Brian Johnson. So we have, very fortunate to have, Charlie Bethel with us, who's the Chief Executive Officer of the UK Men's Sheds Association, which we all have men's sheds in our constituency. Very nice to have you here. We have Tim Taylor, who's the Head of Public Health at Leeds City Council. I continually, in the reading that I do around this inquiry, hear about Leeds and its approach to how seriously it takes men's health, so that's good. You're the apple of our eye. And Sarah Meek, who is the Managing Director of Mates in Mind, which is a charity that provides information to employers on how to support mental health and well-being among staff. So, quick question to all three of you, starting with Charlie. What are the common threads that you see, that you would identify around where men's mental health is in our country today?
I think the most common is that it's not talked about, and people aren't prepared to talk about it in open environments.
Is that right? Because we're always talking about it in here. We're always hearing about it on the media, and people say it's not talked about. I'm sorry to challenge you, but
absolutely. So
why would you say it's not talked about when surely it's constantly talked about?
I don't think it's really talked about in open conversation with people. I think you need to be in the right environment, perhaps with the right activity, and then it is talked about.
Okay.
So very often, and I think it's quite common, I was accused of this last week by my wife, I'll go and talk to somebody for 20 minutes. She'll say, "What were you talking about?" Well, nothing really. And it's just passing time. We may have a conversation, but to really talk about how you're feeling and to come up with those solutions, I think it's important that you're in the right environment to do that. And in the case of men's sheds, it's doing the right activity. So we observe that men will talk shoulder to shoulder, but they won't talk face to face. And the outcomes from sheds are quite clear on that. And the
shoulder to shoulder?
Yeah, so the example I will give is that if you put 12 men in a room and ask them, a square room like this one, and ask them to talk about their feelings, 6 will leave and the other 6 will try to find the corners of that room. Being men, we can't quite work it out. However, if you put a lawnmower in the middle of the room and say, fix it, after 2 hours, those men will know each other intimately. They'll know what ails them, the names of their grandchildren, how they take their tea and coffee, and how they're feeling. And it's because there's that activity, there's that focus, there's that purpose. And that is the environment that we see where men will talk and open up a lot more. It could be an art class, it could be whatever. It happens in the workplace when people are comfortable and feel safe. But it needs to be non-competitive as well.
That's what happens in the sheds.
Yeah, that's what happens in the sheds. But it's a model that doesn't have to just stay in a shed. It can happen in other environments as well. I think that's really important.
Shoulder to shoulder at the urinal. You know, you could talk then, couldn't you? Or does that not happen?
Not
anyway, I'll leave that one hanging, so to speak. Tim, common threads.
Yeah, I think I would agree with that. I think men talk about mental health in different settings. So, thinking about in Leeds, we have some great examples of businesses like Kier Construction, where male-dominated businesses that are talking about men's health and men's mental health. But also you've got barbers, you've got chip shops, you've got kind of non-typical settings. And I think one of the approaches that we've taken in Leeds, which I think is successful, is rather than waiting for people to go to services, you actually go out into the communities. So we have services that go to working men clubs, we have services that go to pubs, perhaps non-typical public health places, but they engage with people, find out what they're interested in, and then set up groups around that. So I think, some men don't want it in the face when they're talking about health, whereas others, perhaps it's health by stealth and doing it in different approaches as well. So I think that's one of the main points I wanted to make. I think the other really is that men aren't homogenous. So, some men will love sheds. I like a shed. But other men like different approaches. So some men like sports, some men might like to go walking. There are different approaches to different people. And I think the other thing just to state is that there are multiple risk factors. So it's not just being a man, but it might be other protected characteristics like your ethnicity. It might be other issues around how much money you have. So we have to look at it through different lenses.
Right, Sarah, same question to you.
Yes, absolutely. I mean, we focus predominantly within construction, and we see a lot of men on the sites of all different backgrounds, ethnicities, and sort of aspects that you find within a building site. And will they talk about absolutely everything else? Yes, probably. But we are seeing some really good pockets of best practice now where it's becoming part of someone's induction onto the site and is as important as the safety aspect. That's taken the construction industry, from where it used to be to where it is now. So where you treat health like safety, you're going to start getting some really good changes there. And also our work with the apprentices coming through the colleges as well. We're preparing the next generation coming into the construction industry to be more aware of themselves, of others. We're training up their tutors in order to deliver that on an ongoing basis, because what we had seen is that the predominantly male students coming through were not accessing the pastoral care of the colleges compared to all the other colleges, all the other courses running through colleges, and people wanted to know why that was. And there is an absolute shift after they have had that awareness session, after they know it's okay, and to recognise the signs in themselves and in others.
Yeah, fascinating. Okay, right, well that's been an illuminating start. Rachel Maskell.
Thank you ever so much. This is a really fascinating area of inquiry, it really is. I was really struck by the Norwich City football advert, which they launched in October. I thought it was incredibly powerful. How can popular media play a stronger role with some of the work that you're doing as well to make those connections with people? If I can turn to you, Charlie.
Yeah, I mean, I think it's awareness, but awareness with a language that speaks to people. So I think that was excellent, not only because of the football setting, but because of the behaviours of those two men. So, men won't necessarily say that they're feeling depressed or they're anxious. They won't necessarily recognise it either. And so they'll talk about being angry or fed up. And I think that the media can promote that as well, so that people can recognise how they're actually feeling, but again in a non-invasive way. It's not, oh, here we go again about our health. It can be funny, it can be a fun way of doing it, but it can also allow people to explore how they feel. But it's that language is really important, because we don't necessarily, and I don't think it's just men, but don't recognise how we feel. So anxiety, and we see it a lot of the time in sheds as well, with the way people will talk and who they talk to, it will change as well. So one of the reasons for men-only sessions is because a guy would, and this is an example from a shed in Camden, a guy was talking to me about how he felt depressed and down after he'd retired, and the honeymoon period, as soon as the person I was meeting, the lady came in, it was, it's at a loose end. So I think it's important that the media uses the right language, but also translates that language as well.
So if I can go in a slightly different path with you, just look at the kind of workplace. Obviously, it's a very powerful place to spend most of our waking hours at work. We often talk about physical health checks. Mental health checks are equally as important. What more can be done in the workspace, and particularly with occupational health?
Absolutely, and I think when you look at things like construction, where you've got a real sort of mixture of people from all different backgrounds. We've got 1 in every 4 within construction who are identifying as neurodiverse, and there's that direct link with an increase in mental health challenges. You've got people who've touched the criminal justice system, again, where we've got some aspects there. So within that suicide prevention strategy, those high-risk areas, those high-risk categories of people, if we know we've got somebody coming into the workplace, what can we do to proactively and preventatively support somebody through their mental health challenges? But I would also say that mental health, as we know, doesn't discriminate according to someone's job role, their background, etc. It can, it can come to anybody at any time, and work-related stress, and in particular the impact that can have around those psychosocial risk factors, can have a huge impact, and a lot of employers aren't actually aware of their duty of care around making sure that it is a psychologically safe environment for somebody to thrive in. And what we see is a lot of services are perhaps favouring towards the crisis support, the reactive, rather than the proactive, when actually it should be a completely holistic model of you've got prevention and then you're breaking down those barriers, you're normalising mental health in the workplace in order to then signpost, hopefully at an earlier stage, rather than waiting for services to respond quickly. Because it has, unfortunately, in some areas become a bit of a tick box exercise where we see things like, 1 in every 2 members of the organisation is mental health first aid trained, but that's unregulated, and it's not doing anything around that prevention and stopping people from getting to that point of crisis.
As we know from our prevention inquiry, don't we, that is not exclusive to mental health. That's everything.
And could the HSE do more? I'm particularly interested in bullying at work. I've got draft legislation around that. Is there more that could be done in those interventions which are taken on that?
Yes, I mean, we would certainly advocate for that. The HSE has got those management standards in place. They do have the ability to go into any organisation at any one time to ask to see those risk assessments, to see where those proactive steps have been taken to address that. But very few, if any, assessments are undertaken. So therefore, my background's in healthcare, and it wasn't until the CQC was coming in unannounced and actually taking a real stance in quality and safety that there needs to be that element of expecting an assessment, a visit to take place. But also, where we perhaps might see some enforcement of that as well, where there has been some consequence of somebody failing in their duty. Because as we know, work-related stress can have such a huge impact. And we lost, our patron lost her husband, Chris, to work-related stress. He was 30 years in the construction industry and was, a very well-respected manager. And unfortunately, through work-related stress, through a lack of sleep, this got to a point where he did take his life. And there needs to be some sort of really strong acknowledgement that work-related stress can kill.
Thank you. And I love what you're doing in Leeds. It's amazing. But there is an issue, funding, and ensuring there is sustainable funding. Now, I noticed that you have drawn down funds from national lottery funds. They come and go. How would you get a sustained funding model to be able to deliver comprehensive service? What do you need from government?
That's a really good point. So I think when we put together the state of men's health in Leeds, it talks about the assets and needs of the city. So we had the Men's Health Network, which has been going since 1998, so it's been going for quite a while. A really diverse set of third sector partners, and listening to the last conversation about the messenger being more important than the message, and trust and lack of trust in local government, central government, NHS. I think those local voices are really crucial in terms of getting some of those messages across. We also had Professor Alan White, who is an expert just next door to where we were, that advises on lots of our approaches. And I suppose that the first bit is that we tried to mainstream our approach. So by having the needs assessment, we're able to train up commissioners in the city. So all of our contracts looked at it through, first of all, a men's perspective with the state of men's health, but then also a women's perspective when we did the subsequent report. And we're also able to bid for money from the big lottery. So we got money for 3 years. We're currently going through another bid at the moment, and we're having discussions, as we speak, really, with big lottery about it. And that's great, but I don't think it's a massively sustainable option. And I think one of the approaches that we took was to work with Men's Health Unlocked, the partners on that, but also the network, to try and represent all of the diversity of the organisations. And I think that was probably what was missing in Leeds. So there was a consortium of women's organisations called Women's Lives Leads that we worked really closely with, and we really looked at their model as a consortium of all of the different talents and interests in the city. So I think there is definitely a need for recurrent funding for that, because otherwise you start up a brilliant project. We have become, I think, an expert reference group. So if people have issues around men's health, they go to Men's Health Unlocked. But if we don't have more than 3 years, then you're starting again, aren't you, really?
Thank you, Chair.
Thank you. Do other local authorities contact you, Tim, all the time and say, we've heard about what you're doing in Leeds, how did you do it?
Yeah, a bit of that, yeah. Well, a variety of different people. So myself and colleagues, so colleagues from Men's Health Unlocked and Alan have presented at various different conferences. So we often get inquiries about that approach. And I think there is similar great work happening up and down the country. I think we're just lucky to have done the needs assessment and to have built on that work, but also have a really strong foundation. So I think we try to share it where we can.
Brilliant. It's really, really interesting. So interesting. James Morris.
Yes. I don't know whether you were here when previous session, and I asked a question. This is to Tim about access to services within the public health system, particularly around IAPT and so on. I don't know whether you've got any comments about the level of funding, the appropriateness of and ease of access to cognitive behavioural therapy for men, and whether or not it's adequately funded, whether or not we need to see a greater sort of variety of approaches. I don't know whether you had any observations about that.
I'm not an expert around IAPS, but I know that there are kind of pressures in terms of access to IAPS in Leeds, like there are in other parts of the country. It is an evidence-based approach, but it won't work for all men. Mm-hmm. So I suppose there needs to be alternatives depending on what the need is.
Mm-hmm. Okay. And for Sarah and Charlie, there's lots of evidence, if you look at about peer-to-peer support is much more powerful. If you take in the school environment, I've done some work where peers talk to peers about mental health issues, the outcomes are incredibly positive. So when you take away authority figures or take away interaction as if it's some sort of shameful problem to be talked about. I was interested in what you said, Sarah, about apprentices. What do you think about? Do we need to do more about peer-to-peer support?
Absolutely. The whole model of Mates in Mind is around support, developing that peer-to-peer support network. So first of all, we start with a general workforce. It becomes everybody's business, because you're going to identify the person who you want to speak to, not the person who's got the right coloured lanyard on, or that you have to go through an office to get somewhere, or it's a room that's the well-being room, for example. You're going to find where you feel most comfortable, which is why it's so important to have that peer-to-peer aspect, and also to have a particular focus on the line managers as well. That squeezed middle who are trying to support whatever the exec direction is, but also to manage the operational things on the ground, and very often have the tools and the ability to be able to change somebody's work pressures. And so again, that's an area that we focus on as well, to make sure that it becomes everybody's business, and gradually through the organisation, and such as we've seen within Balfour Beatty, it's something that becomes part of their induction. There is refresher training.
It's mainstreamed,
absolutely,
as it were.
And through the colleges, that training the tutors to deliver it on an ongoing basis means it's not just a flash in the pan, but actually it just becomes widespread within the college as well. And that transition from classroom to workplace, when, as we know, this is a generation who've lost a lot of their education and their mental health maturity through COVID, they're not perhaps quite as prepared. And we touched earlier upon the importance of social media, of diet, of sleep, of all those other contributory factors of gambling, of alcohol, of drugs, and particularly when it comes to a construction site, you have some of those coming into play, and actually the link potentially with accidents as well. So for the employers to understand the training and the awareness that those students have had actually starts to create that culture change and that change that we so desperately need.
I presume I mean, peer-to-peer support is sort of fundamental to your concept, really.
It's pretty much what it does. But it's not only about the mental health; it's also around the physical. So one of the key things of the environments that are sheds is it gives an opportunity to talk about other health issues, and it might be prostate cancer. But one example would be Fred, who, and I think his name was Fred, but we'll anonymise him to Fred. Fred had lost sight in one eye, and he was starting to lose sight in the other eyes. And his colleagues, his peers, decided to try and do something about it, because Fred wouldn't go to the doctors, wouldn't go to the chemist or the pharmacy. And we see that when you look at thriving communities, and only 24% were men, which is pretty high, bearing in mind they probably wouldn't go to the doctors in the first place. But so he wouldn't go, he followed the trend. But his colleagues looked it up, his peers looked it up, what is it he's got, took him down to the doctors. He can now see out of both eyes. So it's not just the mental health but well-being, it's also the physical. And the same prostate cancer, one shed was telling me last week, they sent or actively encouraged or bullied, whichever way you want to look at it, one of their shedders to go and get his prostate checked.
Right.
Now, he came out with a prescription for something completely different, because when he got in there it was a female doctor, and so the environment there wasn't right for him.
Right.
But he is going back again, and he now knows what to do. But it's that group of peers can encourage you more than somebody telling you. It's them helping you come to that conclusion yourself.
Thank you, Chair.
Fascinating. Call them shedders, did you say?
They not yes.
Like that. Yeah. Sarah, have you ever been asked to work with Parliament, with UK Parliament?
No, but we absolutely encourage any organisation. Whilst we started up originally around construction and we've moved into transport and logistics, any workplace is absolutely open for us to work with. Anywhere where you have got a degree of work-related stress, where you need some awareness, particularly around the restoration and renewal as well of the building itself. Where we've had 6,317 suicides in 2021, 507 of those were within construction. So, when you take on a project of any size, it's extremely important that we build into any procurement, any contract award, what are we going to do preventatively? But absolutely, we would thrive and relish the thought of supporting Parliament on anything to do with mental health awareness and education.
Yeah, well, we'd be a ripe environment. Lots of stress, lots of people who don't look after themselves, and an organisation that just wants to get on with doing what it's doing.
We look forward to hearing from you.
Yeah, don't hold your breath. Paulette, would you like to come in?
Yes, thank you. Good morning all. Charlie, my first question is specifically for you. It's about the sheds. I love the idea. Where are these sheds based? Reason I'm asking is I'm a fanatic. Not that I've got an allotment, but how are you getting people to actually communicate with you, read the sheds? And how have you spread that across to other areas? Because I go to a walking group, I do park run, other men join park run, you've got men that do sports activities. My husband is mad on records, so he's joined a community where they only play vinyl records and nothing past 2000. That can tell you how old I am. But he's a fanatic, not a fanatic, but he enjoys it.
Sounds like you need a shed, Paul.
Trust me. So the point I'm trying to make is, how are you finding these sheds and how are you building the groups?
Yeah, so, first of all, your nearest is Perry Common work shed. So, so you have one
in
there.
my patch?
Yeah, that's yours.
I didn't know that. I'll go and visit it.
Get him down there.
Yeah.
And you've all got sheds within 15 minutes of where you are. So sheds will appear. We help develop sheds. There's a need, so we're quite reactive in some ways, but proactive in others. We talk to community groups. We try to bring groups of men together to set up those sheds because that makes them sustainable. Rather than doing it to the communities, we work with those communities to set up the sheds. And they can be found in retail units, and this is the biggest challenge we have is property. You don't need a property to be a shed. As soon as those men come together, they can be helping each other by being in that group. But we find them in retail units, industrial units, community centres particularly, But there are also a couple in morgues, disused morgues. But morgues.
Oh, God.
So any kind of facility that disused, they're not being used anymore. But they try to find any patch of land, really. Allotments as well are starting to develop sheds, because they also have added value where there's one shed in particular in Weybridge where they provide security over the winter months because the shed is there. They've built a toilet for everybody. They fix everybody's sheds for them. They mow the lawns for everybody. So getting the word out is difficult, and a lot of sheds are already over capacity. They opened a lot more after COVID lockdowns because of the rule of 6, so that encouraged them to open more days. But they are at capacity. We get questions from social prescribing saying, why won't this shed take anybody else? Well, there's a waiting list of 20 from their local community. You're 20 miles away. And our ambition is to see at least 2,500 sheds. We're at 1,200 at the moment across the UK, thanks to the work of many organisations. So our aim is to see that doubled. So there's a shed for every 4,000 people. But somewhere like Orkney has 2 sheds. So it is quite possible that a town of 10,000 could have 2 or 3 sheds within themselves. So, but it's trying to find the property, and it is a case, not to give anyone disservice, but if you build it, people come because it's such a needed environment. And there's a shed in Aldridge not far from you where a group of them will make guitars because that's their interest, and banjos and other musical instruments, and they formed a band as a result of that. And so there's lots of offshoots from what the activities that happen, and all sheds will form what they do, whether it's 3D printing or carving. So
that's fantastic, thank you. And my last question is for Tim. I do know quite a bit about the work that you guys do in Leeds. You have someone that promotes it really well, but the question I wanted to ask, it's about the Leeds dads and the fact that you managed to get 1,000 fathers together, because I'm about numbers. How on earth did you do it?
Well, I can't talk to it. If Errol leads that Leeds Dad programme, would be able to. I can give you some of the contact details around the work that they do. They're a brilliant group, and they're incredibly diverse, different backgrounds, different ethnicities, all sorts of different men that go to that group. I think it's by being fun, and it's by being accessible in different places. But I can forward on the details. I could find out a little bit more about it.
And I'll tell you why I asked, because it's going back to Rachel's question. My concern is, back in the early days, I was the mental health champion in Birmingham, and we managed to start so much of this work. We went on for 3 years, 2 years, 3 years, the bits of funding. Then it all died a death because the money got removed. Is there anything happening to mainstream that work in Leeds so you don't lose the good work that's been done?
Yeah, I mean, I think it is a real risk around third sector funding, and there was a recent report done by the third sector about the significant losses that they've had in the past year or so. I don't know Errol's particular funding formula, but we can find out about it.
It's just a thought. It's so forward thinking. As an authority, local government is always thought of as being reactive and not proactive. At the end of the 3 years, is there just any way of looking at how, if this is as important as people are saying, how is local authorities looking at mainstreaming some of this work?
Absolutely. No, I agree with you.
Well, no answer.
We need more
money. All right, Chair, I'll leave it there.
We need more
Thank
money.
you, Chair.
Right, it was a fascinating insight into the Hamilton household and where she's going to store all this vinyl. Who knows? Who knows? Right, last 5 minutes or so is with Caroline Johnson.
Thank you, Chair. I wanted to ask you a question about the men's shed project, and that you sort of talked about fixing lawnmowers and doing activities together, productive activities together. Just a quick question: do you link do you literally break a lawnmower for it to be fixed, or do you link with other organisations so that your activity is adding to the community in other different ways?
Yes, no, we don't go around breaking lawnmowers.
How do you choose? I guess it's how do you choose the activities, and how do you how do you make them link to the other wider community projects?
Yeah, so first of all, it's that purpose and that focus that is really important that with the shed, and that's time and time again we get told, it's that has allowed me to forget about being lonely or depressed or about my finance. Sheds are, they're all autonomous of us, and they find local projects. A shed will do probably 30% of the work on themselves to make projects, and this Christmas they'll be making lots and lots of reindeers and Christmas trees to sell in the community, to fundraise for themselves. 30% of the time will be spent on shedders making stuff for themselves or the families, and the other element will be working in the community, and that might be making bird boxes. There's a shed on the border of Wales which makes owl boxes for the local wildlife trust, and a whole variety. You can't walk in because of bird boxes everywhere of different sizes. They a shed last year made 17 xylophones for a school because the school said, or the shed found out the school had an issue on funding around the music department. So they did that. Unfortunately for the kids, they then played them to them. But the community centres, they will do raised flower beds, particularly for groups with people with disabilities. So they do work in the community. And part of the impact of that, on one of our surveys of 500 shedders, was that 88% felt more connected to the community after joining a shed. So it's not only the value to the community, and we haven't assessed that, we haven't paid for that kind of research to look at the pound that the shed delivers in the community, but we know that 88% of those people doing that work feel more connected, and they also go on then to volunteer in those different groups as well. So when you're at a railway station, so my village railway station has planters made by a local shed. So they do all sorts of things, and quite bizarre things they'll make as well.
That's really brilliant to hear, actually. The other question I've got is about boys, because presumably a lot of the attitudes and behaviour of men about asking for help, which we've talked about a lot this morning, are set at some point during childhood. So what work are you aware of with boys to try and encourage them to develop the help-seeking behaviour that's been talked about, and to openly talk about their feelings?
I don't quite understand within the shed, or...
We've talked this morning about how men don't like to seek help. They don't ask for help in compared with women. So presumably that's a behaviour that's learnt at some point during childhood. So they're not presumably born not to ask for help. There will be an element to which that's a condition from society. So I'm asking if there's any work to help young boys, teenage boys perhaps, to consider how they can best share their feelings, how they can seek help, and signpost them to what's going on.
I mean, from my perspective and what we observe, it's about role models. And there are a number of sheds that work with schools, and one in particular works with children that are close to being excluded from those schools. And it's showing them positive behaviours. And there was an example at a health conference I attended a couple of weeks ago, where somebody went the opposite way. They were excluded, this was in the early 2000s, and then went to work on a building site at 13, and then went down a dangerous path towards crime and alcoholism and drugs. He managed to turn himself around. So I think it is about giving positive role models in those spaces, and I think that, men's sheds, we're very much in favour of the decision to bring in a men's health champion, because it gives a platform for the conversation to happen. Yes. I think that's essential. Yes. And I think that where you can give those positive role models, we're sitting in my children's primary school, there's only one male teacher in the school. Yes. But that is so important to me and to my son particularly. I have two girls and a boy, and that role model piece is essential, because if you get the right message in, it will help on that journey. It won't solve it completely. We've thousands of years of patriarchy.
Thank you.
Brilliant. Well, thank you very much, Caroline. Thanks very much, Tim Taylor from Leeds City Council, Sarah Meek from Mates in Mind, and Chief Shedder from the UK Men's Shed Association, Charlie Bethel. Brilliant. One of the most interesting sessions we've had in a long time. So thank you very much for your time. Order. The proceeding has ended.